Hello, and welcome to Keynote. I'm your host, Elizabeth Moore. In our September episode, we explored the mental health crisis so many teens are battling with Dr. Michael Kisicki, an associate professor at the Icahn School of Medicine at Mount Sinai and Chief Psychiatrist at the Mount Sinai Adolescent Health Center. In our September keynote, Dr. Kisicki discusses the role social media plays in teens' lives and shares strategies he's seen some families use to support their children's mental wellness. I know we're not pinning this on any one cause, but I do want to touch on social media a little bit because it is such a huge influence since the pandemic. How do you rein in social media in a child's life?
This is a very, very important question that unfortunately there's a lot of disagreement about, but it needs to be discussed. And so first, just some facts. The rate of problematic social media use over the past 5 years has almost doubled. And we know that mental health concerns and suicidal thoughts and behavior are correlated with problematic social media use. Those are facts, okay? But there's a lot of question marks around those facts. What does that mean? Social media is here to stay, so it would be an unrealistic fantasy to say, let's keep our kids off of social media. I wish we could do that, but that's just not going to happen. And that's the world they're going to be living in. So we need to help develop a healthy way for them to participate in social media. What does that mean? Gosh, I wish I knew. I've seen families do different things. Mm-hmm. And I've seen families who will set very strict time limits. And I've seen that work well. I've also seen it just be a fight that led to no positive outcome. I've seen some families who say, use social media, but I want to be a part of it. I want to hear about it. I want to reflect on it with you, and it's a shared experience. I've seen that go well, and I've also seen the kid also develop a second social media account that the parent's not a part of.
Yes, I've heard of that.
I've seen it lead to duplicity. The conversations I personally like the most in families about social media is where they set goals together, where they just talk as a family of like, what does it mean to have problematic use? Where is the line? Mm-hmm. And drawing that up as a family, because different families have different cultures and different attitudes, and I think they can make those decisions as a team. Mm-hmm. But it is something that I feel like our culture has not yet caught up with. It's such a powerful, powerful influence in our daily lives, and just we have not yet figured it out.
No. And it starts with what you said, connection, like having good communication with parents, between parents and children, and being able to talk about it. That's a great starting point. For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.